For decades, Morris Heights has been one of the poorest communities in America. Over half the population lives below the poverty line and receives public assistance. After a wave of arson ravaged the low-income communities of New York City throughout the 1970s, many, if not most residential structures in Morris Heights were left seriously damaged or destroyed. The city began to rehabilitate many formerly abandoned tenement-style apartment buildings and designate them as low-income housing beginning in the late 1970s. It was during this urban renewal that Morris Heights Health Center was founded. At that time, the Morris Heights community was a medical wasteland, and the creation of Morris Heights Health Center was to begin the process of caring for the community by providing basic affordable health care services. The demand for service was overwhelming, and the medical and social needs of the individual clearly demonstrated the need for a much more comprehensive, integrated, and caring approach to care. Now, after over 30 years, Morris Heights Health Center stands as a beacon of hope where ethno-religious culture is as important a consideration as one's medical history, and poverty is regarded as critical a health factor as diet and exercise. Under the leadership of President and CEO Verona Greenland, Morris Heights Health Center has evolved into a multi-site, multi-service organization consisting of 5 freestanding, state-of-the-art facilities, as well as 10 school-based facilities, 2 community-based services offices, and a mobile medical van. Our highly qualified staff takes pride in delivering patient-centered, results-driven care that addresses the immediate needs as well as lifelong health concerns for more than 60,000 patients annually. Our patients not only find the healthcare services exceptional, but are gripped by a sense of familiarity and emotional connection with the center. It's beyond healthcare. The center's vision is ever evolving with the changing times, and we have developed special programs that successfully meet the unique needs of community members while remaining cost-effective. Top-class specialty services are also complemented by primary care, mental health, women's health including labor and delivery, dental care, HIV counseling and testing, WIC services, and urgent care. Over the years, Morris Heights Health Center has impacted the community by addressing the healthcare needs of its eclectic population and boasts many firsts. One of 3 community health centers in the nation that pioneered the comprehensive HIV model program on which the Ryan White HIV Care Act is predicated. The first CHC to provide an out-of-hospital midwifery-run child-bearing center, accomplishing substantial reductions in the community's infant mortality rate, while providing a safe, cost-effective, home-like birthing experience for several thousand women. In 2010, we opened the doors of our new Harrison Circle facility. In addition to our urgent care center, lab, and multi-specialty services, the facility offers community members the convenience of one-stop shopping and rapid treatment of common conditions like asthma. Other services available at this facility include cardiology, dental, a comprehensive mental behavioral health program, and pediatric endocrinology. In demonstrating our philosophy, Harrison Circle stands as a refuge for seniors who are now being priced out of their apartments as the community modernizes. In addition to clinical services, the approximately $50 million 6-story facility includes 70 units of housing for low-income seniors, a true testament to our innovative and trailblazing approach to community development. Morris Heights Health Center continues to advance its mission to make quality, affordable healthcare services accessible to all with the expansion of its specialty care services to include radiology, bone densitometry, mammography, and pulmonary. Additionally, in 2011, Morris Heights Health Center received a $4 million grant from the Office of Adolescent Health in the Department of Health and Human Services for its new Youth Development Teenage Pregnancy Prevention Program, Changing the Odds, an initiative to reach at-risk Bronx youth. From our inception, there has been a strong commitment to creating a healthcare workforce that will want to work and stay in the community. The center has provided learning and training opportunities for doctors, nurses, medical students, and other healthcare professionals including nurse midwives and physician's assistants with the singular purpose of fortifying primary care, exposure to real community, and a reservoir for ongoing recruitment. In fact, Morris Heights University, the center's educational arm, has become the rubric under which all of these teaching activities now fall. Morris Heights Health Center is a recognized Level 3 patient-centered medical home by the National Committee for Quality Assurance. At Morris Heights, patients are treated by doctors, specialists, and support staff, all working together to provide the best possible care. This designation is an extension of our long-term commitment to patient care and medical treatment bolstered by social support. While Morris Heights Health Center has several plans for future growth, many of those goals are steeped in the hopes for enhanced collaboration and strategic alliances. Our goal is to assume a key role in the consolidation of the borough's health services, having identified the need for a regional integrated healthcare system in the Bronx. The current landscape of fragmented service organizations, vying for limited funding, resources, and professional staff, makes it necessary for Morris Heights Health Center to develop partnerships for a comprehensive and integrated approach to care. Morris Heights Health Center, the caring place.